Good morning. It's Saturday morning. Friday night, I did my typical Friday night. I had dinner with my family, had one cocktail because that's what I do on Friday nights. And it's 8:30 and my family is going to go watch a movie upstairs. And I go take a shower and go to bed because I did 9 surgeries yesterday. It was a long week and I'm tired. So I went to bed last night. And I went to bed at 9 o'clock or so. And then at 12:30, phone rings and it's the emergency room in the transfer center at another hospital, wanting to transfer one of my patients who I operated on a couple months ago. And she had a hip. I did a hip 10 years ago and it had gotten loose. And so I revised it 2 months ago. And then she spontaneously popped out, and that shouldn't happen, but it did. And so, we always talk about physician burnout and how, medicine has so much, administrative burden that it burns physicians out. But sometimes it's just the stress of patients. And so, no one likes to have one of their patients have a complication, and me included. I've been doing this for years, and you'd think at some point in time you can just sort of turn that off and become a robot and become immune to it and say, that's some other person's problem, not mine, and I'll just fix it when I get to it. But it really takes a toll. So, from 12:30 to 3 o'clock in the morning, I just sat there and looked at my computer and thought about what I needed to do and how I could help this person, and felt powerless. And then, eventually the patient got transferred to the hospital, and I went and got a couple more hours of sleep. And so here I am before everybody's awake, because I've been essentially awake all night, and I'm going to go find my patient. And that's kind of the burnout. Sometimes it's the administrative burden, but sometimes it's the stress of dealing with a complication that you have to deal with. And, there's a patient, another human being at the other end of the line that needs you. And it's Saturday, and I'm going to have to do a pretty big lift to get this patient fixed, because it's not going to be an easy complication to deal with. They're going to require a major surgery. I'm going to have to coordinate operating rooms, representatives from orthopedic companies. It's going to be a big lift today, and that's going to be my Saturday. And that's kind of why some physicians would burn out, because this type of life would take a toll on people. So what's it like being a physician, right? So sometimes it's actually pretty lonely, because it's Saturday morning and I'm in the hospital just doing what I do, right? So hospital hallways are kind of empty. It's kind of lonely. You got people working on the hospital. You got people that are delivering care to patients. And, most physicians are at home asleep. But here we are in the hospital doing what we do, which is seeing patients, taking care of patients. Sometimes it's kind of a lonely life, but that's the life of a physician. Sometimes get isolated, I think. Sometimes we have alternative views of the world, I guess, and of life, and say, well, this is just life. And sometimes we stand up and have a badge of courage, and sometimes it weighs us down. But it's definitely a unique life, one that's a privilege to have, but sometimes it's a little bit overwhelming. So I'm going to climb the stairs, because that's what I'm going to do, and go find my patient. So here you go. Going to go see my patient. You see the nurses are already outside taking care of the patients. See the red sign on the door. That means the patient's NPO. And now we're going to go have our little meeting, figure out what to do for this patient, explain where she is, what she's done, and where we're going to go, which is going to be a long conversation. So just talk with my patient, and thankfully she's not in a lot of pain, which is a huge benefit. And she's game with whatever. She's like, I trust you implicitly. Do whatever you need to do. Let's get this fixed. And so I'm going to basically mobilize an army of people on a Saturday to help me get her fixed. So that's the Saturday of an orthopedic surgery. Well, been here an hour, coordinating things, talking about the case with my representatives, and it looks like we're going to be able to get this case going for 3 o'clock. So my Saturday afternoon will be spent in the operating room doing what I do to help this little lady out. Fortunately, she's not in a lot of pain, which is good, but certainly mentally taxing. And that's perhaps one of the biggest reasons for physician burnout, is just the mental anguish that we experience on a routine basis when somebody has a complication. And I get it. I've been around a long time. Patients have issues, and sometimes patients with issues need doctors, and that's what we're here for. And that's good, but it does weigh on you, and you can't be mentally strong unless you're letting people know that.